Urinary tract infection by Andrade. Urinary tract infection, also known as UTI, is a general term regarding a common invasion of the urinary tract by bacteria. The urinary system is immune to the infections, but certain microorganisms must invade it before it can be infected. In ascending infections, fecal bacteria colonize the urethra and spread up the urinary tract to the bladder, as well as to the kidneys or the prostate in males. There are different levels of a UTI depending on the location of the infection. The upper and lower urinary tract infections include, for the lower urinary tract infection, the urethritis, which is inflammation of the urethra, parasititis, which is inflammation of the prostate gland, cystitis, which is inflammation of the urinary bladder. For the upper urinary tract infection, pyelonephritis is an inflammation of the kidneys, and the urethritis is inflammation of the ureters. Infections may result in chronic kidney disease, sepsis, or damage to the kidneys. Now we're going to move on to the microorganism and classification. The name of the microorganism and classification of E. coli. E. coli are considered to be unicellular microorganisms, which make them categorized under bacteria for domain and kingdom. E. coli are gram-negative bacterium with an outer membrane containing lipopolysaccharides, allowing them to go under proteobacteria. For class, E. coli are anaerobic gram-negative bacterium that allows them to be categorized under gamma proteobacteria. E. coli are rod-shaped anaerobic gram-negative bacterium, which would be allowing them to be categorized under order. E. coli moves with the phalangia, allowing them to be categorized under Interbacteriaceae family. E. coli mainly colonize and spread in the intestines of mammals, which is under genus as E. coli. E. coli biochemical activities allow them to be categorized under genus E. coli for species. In the circled area is the characteristics of E. coli, which includes its shape as a rod, gram reaction, which is negative, nitrate reduction, which is positive, etc. Where is the microbe found, and how does this microbe affect humans, animals? E. coli is the name of the type of bacteria that is found in the environment, in your lower intestines, and in the intestines of animals. Although most types of E. coli are harmless, some types can really make you sick. E. coli is also found in feces of an infected person or animal. What are the symptoms and physical characteristics of a UTI? A strong, persistent urge to urinate, a burning sensation when urinating, passing frequent, small amounts of urine, blood in the urine, frequent urinating during the night, passing cloudy or strong foul-smelling urine, pelvic disorder or lower back pain, a feeling of pressure in the lower abdomen, or low-grade fevers. Which gender is more prevalent to getting a UTI? Females are 80% more likely to get a UTI compared to males. Because women have a shorter urethra than men, they are more likely to suffer from ascending UTI. The main cause of UTIs at any age is usually bacteria. In older adults who use catheters or live in nursing homes or full-time care facilities are at higher risk for developing a UTI. What are the features of a causative agent of UTI? E. coli is the most etiological agent of UTI. It is number 1 ranked, followed by staph and other bacteria, and E. coli is known as a bacteria. Distribution of disease. Urinary tract infections are among the most common bacterial infection worldwide. Areas with the highest infections include: the top 4 is Canada at number 4, United Kingdom and India at a tie in number 3, China number 2, and number 1 ranked is the United States. Also, patients that are staying in hospital settings or at care home facilities or long-term facilities have a higher percentage of developing a UTI due to their incontinence that they may be experiencing at the time, catheterization, or decrease in mobility, along with many other reasons. Treatment, cure, prevention. Medication treatment. Medication treatments are recommended for treating a UTI. There are different types of medications that can help depending on the severity of your UTI. Listed is the medication class and action with examples of the medication itself. First is antibiotics. Under antibiotics, an example would be azacadam. Next is fluoroquinolones, which is Cipro and Levaquin. The next medication class is sulfonamines, which is Bactrim. Bactrim is effective against E. coli and is used for uncomplicated UTIs. It is urinary antiseptic. Antibacterial action is in the urine, not systemic. Urinary antiseptic, anti-infective, is effective against gram-negative and gram-positive organisms, E. coli. And the last is urinary analgesic, which is a topical analgesic which relieves pain, urgency, and frequency associated with UTIs. What all of these medications have in common is that they all treat E. coli because E. coli is a common cause of a UTI. How can UTIs be prevented? Void frequently, at least every 3 hours while awake. Drink up to 3,000 milliliters of fluid a day, preferably drinking water. Drink 1 glass of cranberry juice, 10 ounces per day. Wipe perineum from the front to the back after toileting. This is very, very important. Urinate after sexual intercourse. Take showers. Avoid tub baths, bubble baths with salts. Perfume feminine hygiene products. Avoid synthetic underwear and constricting clothes such as tight jeans or skinny jeans. Friendly reminder: if diagnosed with UTI, take medication prescribed for UTI until it is all gone. If a UTI is associated with other sources of infection, such as vaginitis, ensure that both infections are treated. Please see your primary physician for further instructions and guidance. Thank you for listening to my presentation on urinary tract infection. I hope you learned about the microorganisms, the treatment, cures, and preventions. Have a wonderful day, and the following slide has all of my bibliography and references to this presentation. Aloha.